Hi everyone, I am Dr. Sudipto Bhattacharya, Senior Consultant, Cardiothoracic and Vascular Surgeon at Jayaprakash Hospital and Research Center, Rourkela. I have joined here with my team of nursing staff, perfusionists, physician assistants, and we have a very well-equipped center over here which is capable of doing all kinds of cardiac, thoracic and vascular work. We are also having a very well-equipped heart team to go by, including our cardiac anesthetist Dr. Somraghi Ganguly and our cardiologist Dr. Trilochan Agarwal. We have also worked in leading centers in India like B.M. Birla Heart Research Center, Peerless Hospital, Kolkata, AMRI Hospitals, Saraswati Heart Care and Popular Hospital, Varanasi. And we are now in the land of Lord Jagannath in Odisha, and we would love to serve you all. Jai Jagannath. Coronary artery health should come as the number one priority in health issues. Why is that? Because we are presently in a pandemic of coronary artery disease or heart disease, because now with the latest advancements in science and technology, with the latest advancements in modern medicine, communicable diseases have mostly been taken care of, and we are left with an aging population with non-communicable diseases like cardiac disease, like cancer and the like. That is why coronary health should be our priority, because the commonest problem that comes to mind, that comes to a physician with heart disease is coronary artery disease. What are coronary arteries? Coronary, the word, means like a crown, the crown that sits on the head of the king. And coronary arteries are arteries or blood vessels that supply the most important organ of the human body, that is the heart. Why is the heart so important? Because it starts beating from the day we are born. It starts beating when a person is still in the fetal stage in the mother's womb, and it continues beating throughout life. God has given us just one heart and we need to care for it. It is one organ which supplies blood, which supplies nutrition to the rest of the organs of the human body, be it the brain, be it the liver, the kidneys, you name it. All the organs are supplied by blood pumped from the heart. So it is the pumping station of the human body. So it is very, very important. So coronary arteries are arteries that supply the heart. They are primarily divided into left and right. Coronary arteries arise from the aorta. Aorta is the major artery that supplies all organs of the body, and coronary arteries, meaning the supply of the heart, also comes from there. So if we consider the left coronary artery, the left coronary artery begins as a left main coronary artery. From there it branches out, just like branches of a tree or the root of a tree. It gives out branches to supply various areas of the heart, mainly supplying the left part of the heart. The major artery that arises from the left main coronary artery is the LAD, or the left anterior descending artery. Along with that, there is the ramus intermedius, or the intermediate artery, and there is the left circumflex artery. These are the arteries arising from the left main coronary artery. Now, again, each of these main arteries also give out branches, like the left anterior descending artery gives out diagonals, the left circumflex artery gives out obtuse marginal arteries, and the like. Now coming to the right side of the heart, it is the right coronary artery which supplies the right side of the heart. The right coronary artery again gives out branches like the acute marginal artery, the posterior descending artery, and the posterior left ventricular artery. So all these arteries comprise of the coronary artery system that supplies the heart. And these are the vessels that are responsible to carry blood to the heart, to various areas of the heart, so that heart gets adequate blood, adequate nutrition, so that it is capable of handling enough blood by itself and pump continuously since life up till death. So coronary arteries, I have already discussed what they are. The most common disease affecting coronary arteries is ischemic heart disease or coronary artery disease. That is the most common disease affecting coronary vessels. Other than that, there are several congenital conditions which may affect the coronary arteries, like congenital coronary artery aneurysms. There may be coronary artery fistulas. There may be Kawasaki disease, where by children have aneurysmal coronary arteries, etc. These are comparatively rarer conditions affecting the coronary arteries. Coronary artery is the major killer in the 21st century. It develops slowly. It develops due to multiple risk factors affecting us, like hypertension, diabetes, high cholesterol levels, a sedentary lifestyle, also addictions like smoking, alcohol, etc. and mental health disorder like stress, like depression. All this results in coronary artery disease. It develops gradually, resulting in plaques or lipid deposits in the arteries supplying the heart, that is the coronary arteries. And that deposition, that lipid deposition, that fat deposition goes on till blockages occur. Blockages for the blood to pass through those channels and reach the areas that they have to reach to supply the heart. So when these blockages are significant, more than 50% blockages or more than 70% blockages, then gradually symptoms occur. And when the blockages are significant enough, like they reach to critical stages like atherosclerosis resulting in myocardial infarction. And how does the patient come to know? The patient comes to know it by virtue of few symptoms: angina, chest pain, discomfort in the chest, respiratory distress. All these factors are important and they lead to the patient coming to know that yes, I may have some coronary artery disease or something, so that I may visit a physician, I may visit a cardiologist, who after some tests like the TMT, that is the treadmill test, if it is positive, may ask you to undergo coronary angiography, whereby a dye is pushed through an artery like the right radial artery or the right femoral artery, and the vessels of the heart come into view, and any blockages thereby come into light, so that they can be addressed either by stenting or through bypass surgery. Certainly there are multiple risk factors which make an individual prone to coronary artery disease. Some are modifiable risk factors, some are non-modifiable risk factors. Now what are the modifiable risk factors? What is the meaning of the term modifiable? Means you can change it to a certain extent, thereby reducing the risk of you having this disease. So what can you do? Like you maintain a healthy, disciplined lifestyle. By that, what do we mean? We mean consciously avoiding a sedentary lifestyle, regular exercise. What kind of exercise should you do? At least 30 minutes of walking 6 days a week will help. Next, control your body weight. You should not be overweight or obese. You should not be hypertensive. If you are hypertensive or having high blood pressure, that needs to be controlled with medications. Control your salt intake. Control your blood sugar levels. If you are diabetic, diabetes needs to be controlled. Your thyroid disorder needs to be controlled. And stress has to be mitigated. Stress levels, as we know, cannot be measured, but they need to be mitigated. There may be stress coming from office, from personal life, etc., which needs to be medicated, and mental health needs to be taken care of. So both physical and mental health need to be taken care of. Addictions should be avoided, like smoking, alcohol, tobacco, etc. And that is how you can avoid the modifiable risk factors. Now, what are the non-modifiable risk factors? Number one is age. The more we age, the more prone are these blood vessels supplying the heart. They are prone to atherosclerosis. They are prone to coronary artery disease. But this is something beyond our control because we will all age. So, that is something beyond us. Next is sex. As we know, males are more prone to coronary artery disease than females. But yes, after menopause, this risk becomes more or less equal in both males and females, because there are certain hormones secreted by the young females which are protective against coronary artery disease. Next, there may be other non-modifiable factors like genetics. Indians and South Asians are more prone to coronary artery disease because of your genetic makeup. That is something beyond us that we cannot control. So, there are both modifiable and non-modifiable risk factors for coronary artery disease. Coronary artery disease has certain warning signs and symptoms, which includes angina on exertion. Now, what kind of exertion? It may be a simple case of constipation, it may be just riding up a flight of stairs, or running, or rushing, or walking, or brisk walking. Angina may present. What is angina? Angina may be a pain or a discomfort in the chest. It may be in the back of the chest. It may radiate down your shoulders, down your right shoulder. It may not. In diabetics, often angina is masked. The symptoms of angina are masked. It may occur as a case of discomfort or pain in the chest. It may occur as breathlessness or dyspnea on exertion, or it may occur as palpitation. Somebody on exertion is having palpitation. When he sits down or takes rest, that palpitation goes away, or that chest pain goes away, or the breathlessness goes away. That is a telltale sign of angina. It may occur as a case of syncope, whereby, all of a sudden you see everything is turning dark around you. You are having dizziness, you are having vertigo. So, critical left main or coronary artery disease may also present like that, as a case of syncope, as a case of breathlessness, sweating. It may present like a myocardial infarction or a heart attack. If a major vessel supplying the heart is blocked, then the person may have a heart attack, may have to be taken to the emergency directly. The patient may have a cardiac arrest and CPR has to be done. Cardiopulmonary resuscitation has to be initiated at the earliest to save the life of the patient. The patient may have a sudden cardiac death owing to coronary artery disease. So these are the things that it may lead to, and it may be as disastrous as death of the individual. Lifestyle changes that we should adopt to maintain healthy coronary arteries include our daily routine. That is, maintaining at least 7 to 8 hours of sleep per day for an adult individual, which is recommended. The American Heart Association recommends that brisk walking should be done at least 6 days a week for 30 minutes. So thereby we are avoiding a sedentary lifestyle. We can keep our weight in check. If we are overweight or obese, we should try and control our weight by doing dieting, by walking, by exercise, etc. Also, we should keep hypertension in check. If we are hypertensive, that is having high blood pressure, we should take medications to control blood pressure. If we are diabetic, we should take medications to control our blood sugar levels. If we are having thyroid disorder, we should control our thyroid. Also, if we are having lung disease, COPD, that itself is a comorbidity that we should control by taking inhalers, by listening to our doctors, by doing pranayam and other exercises, lung exercise, chest exercise, etc. Also, what we can do is curb pollution. As we know, the major metro cities including Delhi, Kolkata, they are very, very polluted, and this pollution affects not only the lungs but the heart as well. So all this effect, if we can control, then we can keep coronary artery disease at bay. Maintaining a healthy lifestyle, avoiding junk food, avoiding alcohol, which puts on empty calories. Instead, we can take fresh fruits, vegetables, okay, so that will help. And high cholesterol substances like red meat, etc., should be avoided. The egg white is good, but not the yolk of the egg too many times a week. Say 3 or 4 times a week is okay, but not more than that. So thereby keeping our cholesterol levels in check, our triglyceride levels in check. So all this we can do to promote a healthy heart. Diet in coronary artery disease is very important. First comes salt. How much salt should you take? Because if you're having hypertension, 4 grams of salt is the limit. If you cut down on your salt, your hypertension will be in check, and thereby coronary artery disease will be in check. What about diabetics? Diabetics should avoid high sugar, high calorie food and keep their HbA1c in check. If your HbA1c is between 5 to 7, that is excellent, but if it is going beyond 7, then you should visit your endocrinologist or your diabetologist immediately. Also, heart healthy foods include all fresh fruits and vegetables. If you are having meat, red meat should be avoided or should be taken low in amount. Also, egg yolk. Too much egg yolk is not good because it's having high cholesterol, so it should be taken in moderate amounts. More of fresh fruits and vegetables in your diet will aid in having the vessels to be heart healthy, and thereby you can keep coronary artery disease at bay. How can we prevent and what precaution should we take? Every hospital, including ours, has started a preventive heart health checkup. Now what it is? An annual heart health checkup, when you're not having any symptoms, helps to diagnose any underlying condition which you may be having and may be presenting to the emergency. Instead of that, you detect it early. Suppose you undergo a 12-lead ECG, you undergo an echocardiography. If needed, the doctor examines you and suggests you to go for a TMT or a treadmill test if required, a chest X-ray. All these investigations are part of the preventive coronary heart health checkup or preventive heart health checkup program. So annually, at least once, all individuals who are in their 30s, 40s, 50s and beyond should undergo an annual preventive heart health checkup, so that you can prevent emergencies like a myocardial infarction, like a heart attack, like sudden cardiac death, because you don't know what is affecting you till you get tested. So unless you get tested, unless you go to the physician, unless you visit your cardiologist and he examines you, you wouldn't even know, because myocardial infarction, coronary artery disease often is a silent killer. When it comes in a bad way. So keeping it at bay would be the way to go. Thank you.